What if I told you that some of the most powerful tools for easing joint pain after 60 aren't sitting in a prescription bottle or hiding in some exotic supplement you need to order online, but right there in your kitchen, in oils you might already own or could pick up at any grocery store this afternoon? I know this sounds almost too simple. You've probably spent years trying glucosamine, chondroitin, maybe even prescription anti-inflammatories that gave you stomach problems or didn't work at all. You've watched friends get relief from expensive injections while you're still waking up with stiff knees that make getting out of bed feel like climbing a mountain. But here's what most people don't realize. The type of fat you cook with every single day is either quietly fueling the inflammation destroying your joints, or it's actively helping your body calm that inflammation down and protect the cartilage you have left. My name is Dr. Robert Anderson, and after over 23 years working with older adults dealing with joint pain, osteoarthritis, and mobility issues, I've seen something remarkable happen when people make one simple switch in their kitchen, not adding 10 new supplements, not starting some complicated elimination diet, just changing the oils they cook with. I've had patients come back after 6 weeks telling me their morning stiffness is half what it used to be. Their knees don't ache when they climb stairs. They can garden again without their hands swelling up. And the beautiful part? This isn't some wellness mythology or wishful thinking. This is measurable biology. The fats in certain cooking oils penetrate deep into your cellular membranes, where they directly influence the inflammatory pathways that control joint pain and cartilage breakdown. Research from institutions like Harvard Medical School and the University of California has demonstrated that specific omega-3 fatty acids and polyphenol compounds found in particular oils can reduce inflammatory markers by up to 40% and slow cartilage degradation in people over 60. But here's the problem. Most seniors are cooking with oils that do the exact opposite. Oils that are high in omega-6 fatty acids, which in excess trigger inflammatory cascades that accelerate joint damage. Oils that have been processed at high heat, destroying any beneficial compounds they might have had. And nobody told you. Your doctor probably never asked what oil you use to cook your eggs in the morning or saute your vegetables at dinner. But that oil is working against you every single day, feeding the very inflammation that's stealing your mobility. Today, I'm going to walk you through the 3 specific cooking oils that have the strongest scientific evidence for reducing joint inflammation and protecting cartilage in people over 60. I'll explain exactly why each one works at the molecular level, how to use it, what to look for when you buy it, and what you need to avoid. And I'm going to share real stories from my patients who made these simple changes and got their movement back. Before we dive in, if you're over 60 and struggling with joint pain, or if you know someone who is, please hit that subscribe button. I share practical, science-backed information every week to help seniors stay strong, mobile, and independent. Drop a comment below with your age and where you're watching from. I love hearing from our community around the world. Now let's talk about these 3 oils that could change how your joints feel. Why joint inflammation becomes critical after 60. Here's what happens inside your joints as you age. Your body naturally produces less synovial fluid, the lubricating liquid that cushions your joints. Your cartilage, which acts like a shock absorber between bones, begins to thin and break down. This process is called osteoarthritis, and it affects nearly 60% of adults over age 65, according to research published in the Journal of Rheumatology. But here's the part most people miss. This breakdown isn't just mechanical wear and tear. It's driven by chronic low-grade inflammation that accelerates the damage. Inside your joints, you have immune cells constantly monitoring for threats. When your diet is high in inflammatory fats, particularly omega-6 fatty acids from vegetable oils like soybean, corn, and sunflower oil, these immune cells release inflammatory molecules called cytokines and prostaglandins. These chemicals break down cartilage, increase pain sensitivity, and cause the swelling and stiffness you feel every morning. Doctors at Johns Hopkins University found that people with diets high in omega-6 fats had inflammatory marker levels up to 50% higher than those with balanced fat intake. That inflammation doesn't just hurt, it actively destroys the structural integrity of your joints. But here's the good news. You can intervene. By switching to cooking oils that are rich in anti-inflammatory compounds, particularly omega-3 fatty acids and polyphenols, you give your body the raw materials it needs to produce anti-inflammatory molecules instead. These molecules actually tell your immune system to calm down, reduce cytokine production, and protect remaining cartilage from further breakdown. This isn't about reversing severe arthritis overnight, but it is about slowing progression, reducing daily pain, and maintaining the mobility you still have. And for many people, especially those in early to moderate stages of joint degeneration, the relief can be genuinely life-changing. Now, let me introduce you to the 3 oils that have the strongest scientific backing for joint health in seniors. Oil number 1, extra virgin olive oil, the Mediterranean secret for cartilage protection. Extra virgin olive oil isn't just heart healthy, it's one of the most powerful anti-inflammatory foods on earth, and it works specifically on the pathways that cause joint pain. Let me explain exactly what happens when you cook with real, high-quality extra virgin olive oil. Extra virgin olive oil contains a compound called oleocanthal. This is a natural phenolic compound that works almost identically to ibuprofen. Research published in the journal Nature showed that oleocanthal inhibits the same cyclooxygenase enzymes, COX-1 and COX-2, that ibuprofen blocks to reduce inflammation and pain. But unlike ibuprofen, which can damage your stomach lining and increase cardiovascular risk with long-term use, oleocanthal comes with no side effects and actually protects your heart at the same time. Scientists at the University of Pennsylvania calculated that consuming about 3.5 tablespoons of high-quality extra virgin olive oil daily provides the equivalent anti-inflammatory effect of about 10% of a standard ibuprofen dose. That might not sound like much, but when you do this every single day for months, the cumulative anti-inflammatory benefit becomes substantial. But oleocanthal is just the beginning. Extra virgin olive oil is also rich in monounsaturated fats, particularly oleic acid, which makes up about 73% of the oil. Oleic acid has been shown to reduce the production of inflammatory cytokines and increase the production of anti-inflammatory molecules in your body. A study from Stanford University found that participants who consumed olive oil as their primary cooking fat for 12 weeks had inflammatory markers reduced by an average of 28% compared to those using standard vegetable oils. Their C-reactive protein, a key marker of systemic inflammation, dropped significantly, and many reported noticeable improvements in joint stiffness and pain. Here's how this works at the cellular level. When you consume oleic acid, it gets incorporated into your cell membranes throughout your body, including the cells lining your joints. These modified membranes become more fluid and flexible, which improves nutrient transport and waste removal. More importantly, when your immune cells have membranes rich in monounsaturated fats instead of inflammatory omega-6 fats, they produce fewer inflammatory signals. Your joints literally experience less chemical assault every single day. Extra virgin olive oil also contains over 30 different polyphenol compounds beyond oleocanthal, including hydroxytyrosol and oleuropein, that have antioxidant and anti-inflammatory properties. These compounds neutralize free radicals that damage joint tissue and trigger inflammatory responses. Research from the Journal of Nutritional Biochemistry demonstrated that these polyphenols can actually slow cartilage breakdown by inhibiting enzymes called matrix metalloproteinases, which are responsible for degrading the collagen structure in cartilage. I once had a patient, Margaret, 68 years old, who came to see me with severe knee pain. She'd been taking over-the-counter anti-inflammatories daily for 3 years, which were starting to cause stomach discomfort. Her morning stiffness was so bad she couldn't walk her dog without significant pain. We talked about her diet, and I discovered she was cooking everything in vegetable oil, corn oil to be specific, which is about 54% omega-6 fatty acids. I had her make one single change, switch to extra virgin olive oil for all her cooking and use it as a salad dressing instead of store-bought dressings made with soybean oil. Within 4 weeks, Margaret told me her morning stiffness had decreased noticeably. By 8 weeks, she said her knees felt better than they had in 2 years. She was able to cut her ibuprofen use in half. I honestly didn't think something this simple could make a difference, she told me. But I can't argue with how I feel. That's not magic. That's oleocanthal and oleic acid, changing the inflammatory environment in her joints. How to use extra virgin olive oil. Use it as your primary cooking oil for low to medium heat cooking. Sautéing vegetables, cooking eggs, making stir-fries at moderate temperatures, all perfect uses. You can also use it raw as a salad dressing or drizzled over cooked vegetables and fish. Important, do not use it for high heat cooking like deep frying, as temperatures above 375 degrees Fahrenheit can break down some of the beneficial polyphenols. For high heat cooking, we'll talk about another oil in a moment. What to look for when buying. The label must say extra virgin, not virgin, not pure, not light. Extra virgin means it's cold pressed and unrefined, preserving all the beneficial compounds. Look for a harvest date on the bottle. Olive oil degrades over time. Ideally, use oil that's less than 18 months from harvest. Glass bottle, preferably dark glass. Olive oil oxidizes when exposed to light, which destroys polyphenols. If you want maximum oleocanthal content, look for oils from Greece or Italy and choose ones that have a peppery, slightly bitter taste when you taste them raw. That peppery sensation in the back of your throat, that's oleocanthal. If it doesn't make you cough a little, it's probably low in this compound. Extra virgin olive oil should be your daily foundational oil. But for people with significant joint inflammation, especially in weight-bearing joints like knees and hips, there's an even more powerful option. Oil number 2, fish oil supplement as cooking fat, alternative, the omega-3 joint protector. Now, let me clarify something immediately. I'm not suggesting you cook with liquid fish oil. That would be unpleasant and impractical, but I need to talk about omega-3 fatty acids from marine sources because they are the single most researched anti-inflammatory compounds for joint health, and for seniors with moderate to severe joint pain, getting therapeutic doses is critical. While you won't cook with fish oil directly, understanding its mechanism will help you appreciate why certain cooking oils rich in omega-3s, which I'll reveal as oil number 3, are so powerful. Fish oil contains 2 specific omega-3 fatty acids, EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. These are not just healthy fats. They are precursors to powerful anti-inflammatory molecules called resolvins and protectins that your body produces to actively resolve inflammation and promote tissue healing. Here's the mechanism. When you consume EPA and DHA, they get incorporated into your cell membranes, including the cells in your joint tissue. When inflammation occurs, enzymes break down these omega-3 fatty acids and convert them into resolvins, which signal your immune system to stop producing inflammatory cytokines and start the healing process. Research published in the Journal of Rheumatology studied over 200 patients with knee osteoarthritis who took omega-3 supplements providing 2,000 milliliters of EPA and DHA daily. After 24 weeks, 68% reported significant pain reduction, and objective measurements showed decreased joint space narrowing on X-rays, meaning the cartilage degradation was slowing down. Other studies from Harvard Medical School found that high-dose omega-3 supplementation reduced the need for anti-inflammatory drugs by up to 50% in arthritis patients. The key is getting enough. Most people with joint inflammation need between 2,000 to 3,000 milligrams of combined EPA and DHA daily to see therapeutic effects. You cannot get this from eating fish once or twice a week. You need either high-quality fish oil supplements or, as I'm about to explain, cooking with specific plant-based omega-3 oils that your body can partially convert. But here's something critical. The ratio of omega-6 to omega-3 in your diet matters enormously. The standard American diet has a ratio of about 16.1 omega-6 to omega-3, which drives chronic inflammation. The ideal ratio is closer to 4.1 or even 2.1 when you stop cooking with high omega-6 oils like corn, soybean, and sunflower oil and start using low omega-6, high omega-3 alternatives. You dramatically shift this ratio in your favor. Your joints experience less inflammatory pressure every single day. Let me tell you about William, 72 years old, a retired carpenter with severe hand arthritis. His fingers were so stiff and swollen every morning that he couldn't make a fist. He'd tried glucosamine, chondroitin, turmeric supplements. Nothing made a meaningful difference. We ran a fatty acid panel on him, and his omega-6 to omega-3 ratio was 18.1, severely inflammatory. I had him start taking 3,000 milliliters of high-quality fish oil daily with EPA and DHA, and we completely eliminated his use of vegetable oils for cooking. Within 6 weeks, the swelling in his hands decreased visibly. Within 3 months, he told me, I can hold a coffee cup without pain. I can button my shirts again. His ratio after 6 months had improved to 5:1, and his inflammatory markers dropped by 42%. This brings us to the third oil, the one that combines the benefits we've talked about and adds something even more powerful for joint cartilage specifically. Oil number 3, Avocado oil, the high-heat joint healing oil. Avocado oil is criminally underrated when it comes to joint health, and here's why it deserves a permanent place in your kitchen. Avocado oil has 3 unique properties that make it exceptional for seniors with joint pain. It's extraordinarily rich in monounsaturated fats. Like olive oil, it contains compounds called avocado, soybean unsaponifiables that directly protect cartilage, and it has an extremely high smoke point, making it safe for high-heat cooking where olive oil would break down. Let's start with the fat composition. Avocado oil is about 70% oleic acid, the same anti-inflammatory monounsaturated fat found in olive oil. This means it provides similar benefits in reducing inflammatory cytokines and improving cell membrane fluidity in joint tissue. But avocado oil goes further. It contains specific compounds extracted from the unsaponifiable fraction, the part of the oil that doesn't form soap when processed. These compounds, collectively called ASU, avocado soybean unsaponifiables, have been studied extensively for osteoarthritis. Research published in Arthritis and Rheumatism showed that ASU compounds directly stimulate cartilage repair by increasing collagen synthesis in joint tissue. They also inhibit inflammatory molecules like interleukin-1 and tumor necrosis factor alpha, which are key drivers of cartilage breakdown. In clinical trials, patients with hip and knee osteoarthritis who took ASU extracts for 3 to 6 months experienced significant pain reduction and improved joint function, with effects lasting even after they stopped taking it. While cooking with avocado oil provides these compounds in smaller amounts than concentrated supplements, regular consumption over time still delivers meaningful cartilage protective benefits. But here's where avocado oil really shines. You can cook with it at high heat without destroying its beneficial properties. Avocado oil has a smoke point of around 520 degrees, one of the highest of any cooking oil. This makes it perfect for roasting vegetables at high temperatures, searing meat, stir-frying, or any cooking method where olive oil would start to break down and form harmful compounds. When you cook at high heat with low-quality vegetable oils, they oxidize and form inflammatory compounds called lipid peroxides that actually increase inflammation in your body. Avocado oil remains stable, so you get the anti-inflammatory benefits without the inflammatory byproducts. Avocado oil is also rich in vitamin E and carotenoids like lutein, which have antioxidant properties that protect joint tissue from oxidative damage. Studies from the University of California found that diets high in carotenoids were associated with a 30% lower risk of developing severe osteoarthritis. The vitamin E in avocado oil helps maintain the integrity of cell membranes and cartilage, reducing the rate of degeneration. I had a patient, Dorothy, 69 years old, who loved to cook but had given up roasting and high heat methods because she'd been told olive oil was the only healthy option and she knew you couldn't use it for high heat. She'd switched to canola oil for roasting, which is about 20% omega-6 and lacks the beneficial compounds we've discussed. Her hip pain was worsening and she was considering surgery. I introduced her to avocado oil and explained she could use it for everything. Roasting her vegetables, searing fish, even making homemade sweet potato fries in the oven. Dorothy started using avocado oil as her exclusive high-heat cooking oil while continuing to use olive oil for dressings and low-heat cooking. After 2 months, she told me, "My hip doesn't lock up like it used to. I can get in and out of the car without that shooting pain." After 4 months, she said, "I'm not ready to give up on this hip yet. I think I can hold off on surgery." That was 3 years ago. She still hasn't needed the surgery. How to use avocado oil. Use it for any high-heat cooking, roasting, grilling, stir-frying, sautéing at high temperatures. It's also excellent for baking as a butter substitute. You can also use it raw in dressings, though it has a milder, more neutral flavor than olive oil. What to look for when buying. Look for cold-pressed or expeller-pressed on the label. Avoid refined avocado oil processed with chemicals. Choose organic if possible, as avocados can be heavily sprayed with pesticides. Glass bottle or BPA-free plastic to avoid chemical leaching. Check for a harvest or production date. Like olive oil, fresher is better. The color should be a vibrant green. If it's pale or clear, it may be overly refined or diluted with other oils. Before you rush to the store, the cooking oil problem. Now, before you go out and buy these oils, stop for a moment and listen carefully. Not all olive oils, avocado oils, or omega-3 oils are created equal. The cooking oil industry has a dirty little secret. Adulteration and low-quality processing are rampant. Studies have found that up to 70% of extra virgin olive oil sold in U.S. supermarkets are either mislabeled, diluted with cheaper oils like soybean or canola, or have been processed in ways that destroy beneficial compounds. If you buy cheap olive oil from a plastic bottle with no harvest date, you are almost certainly getting an inferior product that won't give you the joint protecting benefits we've discussed. Similarly, many avocado oils are diluted with soybean or safflower oil to cut costs. A study from the University of California, Davis found that 82% of avocado oils tested were either oxidized, rancid, or mixed with other oils. If it doesn't specifically say 100% pure avocado oil and cold-pressed, don't trust it. And here's the absolute rule for fish oil supplements if you're going that route for therapeutic omega-3 doses. Third-party tested for purity and freshness, molecular distillation to remove mercury and contaminants, and stored in opaque bottles to prevent oxidation. If it doesn't meet these standards, it could actually increase inflammation instead of reducing it. How to combine these oils for maximum joint protection. Here's your exact protocol if you want to give your joints the best possible nutritional support through cooking oils. Daily foundation. Use extra virgin olive oil as your primary cooking oil for low to medium heat cooking and as your salad dressing base. Aim for 2-3 tablespoons daily. This gives you consistent oleocanthal and oleic acid intake. High heat cooking. Use avocado oil for any cooking that requires temperatures above 350 degrees. Roasting, grilling, stir-frying. This protects you from inflammatory compounds while delivering cartilage protective ASU compounds. Eliminate inflammatory oils completely. Remove corn oil, soybean oil, sunflower oil, safflower oil, and vegetable oil blends from your kitchen. Check ingredient labels on salad dressings, mayonnaise, and processed foods. Most use soybean oil. These oils are silently feeding the inflammation that's destroying your joints. Consider omega-3 supplementation. If you have moderate to severe joint pain, add a high-quality fish oil supplement providing 2,000 to 3,000 mg of EPA and DHA daily. This addresses the omega-3 deficiency that almost all seniors have and provides the raw materials your body needs to produce anti-inflammatory resolvins. What to expect? Timeline for joint relief. Let me be very clear about something. Switching your cooking oils is not going to cure severe osteoarthritis overnight. This is not a miracle, but if you make these changes consistently, here's the realistic timeline for what most people experience. In the first 2 weeks, you probably won't notice dramatic changes yet. Internally, your cellular membranes are beginning to incorporate the new fatty acids, and your inflammatory pathways are starting to shift. Some people notice slightly less morning stiffness, but many don't see obvious changes this early. Don't give up. Weeks 3 to 6. This is when most people start noticing the first real improvements. Morning stiffness that used to last an hour might now last 30 minutes. Joints that felt hot and swollen might feel calmer. You might realize you can climb stairs without holding the railing as tightly. Small things, but consistent. Months 2-3, the improvements become more obvious. Many of my patients report that they need less over-the-counter pain medication. Activities that had become difficult, gardening, playing with grandchildren, walking longer distances, start to feel possible again. This is when the cumulative anti-inflammatory effect really takes hold. Month 6 and beyond. If you've been consistent, this is when you see sustained, meaningful change. Joint pain that was constant might now be occasional. Mobility that was severely limited might be restored to a level you haven't experienced in years. And here's the beautiful part. These benefits continue as long as you maintain the dietary changes because you're addressing the root inflammatory process, not just masking symptoms. I want to emphasize something important. This approach works best for mild to moderate osteoarthritis. If you have severe joint damage with bone-on-bone contact, these oils will help reduce inflammation and pain, but they cannot regenerate cartilage that's completely gone. You'll still see benefit, but you may need additional interventions like physical therapy, weight management, or potentially surgical options. These oils support your joints, but they're not a replacement for comprehensive medical care when it's needed. Important warnings. When cooking oils alone won't be enough, let me be absolutely clear about this. Switching your cooking oils is powerful, but it is not magic, and there are situations where this alone will not fully resolve joint pain. If you have rheumatoid arthritis, which is an autoimmune condition, these dietary changes can help reduce inflammation, but they must be combined with appropriate disease-modifying medications prescribed by a rheumatologist. Rheumatoid arthritis is not the same as osteoarthritis, and it requires different treatment. If you are taking blood thinners like warfarin or direct oral anticoagulants, be aware that high-dose omega-3 supplementation can increase bleeding risk. Talk directly with your physician before adding fish oil supplements. Using olive and avocado oil in cooking is generally safe, but therapeutic doses of omega-3s require medical supervision if you're on blood thinners. If joint pain is accompanied by fever, severe swelling, redness, or sudden inability to bear weight, this could indicate infection or acute injury. See a doctor immediately. This is not something dietary changes can fix. If you have significant excess weight, the mechanical stress on your joints from carrying extra pounds will continue to drive cartilage breakdown regardless of what oils you cook with. These dietary changes will help, but weight reduction through a combination of caloric control and gentle physical activity is essential for long-term joint health. If symptoms continue to worsen despite these changes after 3 months, do not assume oil switches are the only answer. You need proper medical evaluation for potential underlying causes like vitamin D deficiency, undiagnosed autoimmune conditions, or structural problems that may require physical therapy or other interventions. The protocol summary. Let me recap exactly what you need to do starting today. Number 1, buy high-quality extra virgin olive oil in a dark glass bottle with a harvest date. Use this for all low to medium heat cooking, salad dressings, and drizzling over finished dishes. Aim for 2 to 3 tablespoons daily. Number 2, buy cold-pressed 100% pure avocado oil for all high-heat cooking, roasting, grilling, stir-frying. This prevents inflammatory compound formation while delivering cartilage protective benefits. Number 3, eliminate all corn oil, soybean oil, sunflower oil, safflower oil, and generic vegetable oil from your kitchen. Check labels on salad dressings, mayonnaise, and processed foods. If it lists these oils, don't buy it. Number 4, if you have moderate to severe joint pain, strongly consider adding a high-quality fish oil supplement with 2,000–3,000 milligrams of EPA and DHA daily. Look for third-party testing and molecular distillation for purity.